So without further ado, I'd like to introduce Louise Gao, who will be hosting today's 11th webinar on protecting your eyes. Louise, can you do a quick intro?
Hi, thank you for having me. Really kind of you to invite me back. I am an optometrist. I qualified 30 years ago this year, actually, which is a bit scary. I have been working for RNIB for the last 15 years, firstly in the low vision clinic there, and then more recently as the lead for eye health, low vision and optometry. So I manage the low vision service, all of the training that we do, and the health and social care training too. So all the optometry training and the health and social care, and all our eye health booklets and information that you'll find online from RNIB about eye health. And I also work for Seeability, which is a special schools service, optometry service, and St Thomas's Hospital in their low vision clinic, and I do a little bit of teaching at City University. So that's me. I'm going to talk to you today about how we can look after our eyes. So what I'm going to try and do is not go down too many rabbit holes, because those of you, there's a few familiar faces on the call. Those of you who know me, I do tend to go down rabbit holes. So I'm going to try and keep on track to give you plenty of time to ask questions towards the end. And those of you who maybe didn't hear me earlier, I am hotspotting my phone from a hotel room, so I'm desperately hoping I don't crash out. So here we go. I'm going to share my screen. It did work earlier, so I'm hoping it will work. Has everyone got that? It's working. Now, you will get a copy of this, a Word copy and PowerPoint copy. I'm not going to say anything that isn't on the slides, so don't worry about the slides at all. But I know some people like to see the slides as well. So the overview is we're just going to look at a few things that we can do to protect our vision, and then I'm going to give you, hopefully a good amount of time to ask questions at the end. So we're going to start off just looking at a few points. So ultraviolet light, smoking, DIY and sports injuries, makeup and eye infections, keeping fit, and other forms of avoidable sight loss. All of these are important to everyone who has some level of usable vision. So I hope that you will find the advice in this talk helpful. So we're going to start with ultraviolet light. I've got a picture on the screen, and it's a lovely picture of a rainbow over a mountain with a valley, and all the beautiful colours that you get in the visible light spectrum. So I'm showing that to illustrate what UV is. So ultraviolet light is very short wavelength light that is not visible to human eyes. So we have a visible spectrum that our eyes can detect if we have functioning cone cells on the retina. They're the light sensitive cells, and that range of light goes from around about 400 nanometers up to around about 900 nanometers. And the short wavelength is the blue violets, and the long wavelength are the reds, and then going into infrared, which we can't see either. So UV is categorized in three categories: UVA, UVB, UVC, and you may have come across these when you've had sunblock bottles, because different levels of ultraviolet light, the different wavelengths of ultraviolet light affect skin cells differently. So UVA is the longest of the wavelengths, 315 to 400 nanometers. UVB is in the middle, it's 280 to 315 nanometers, and UVC is 100 to 280 nanometers. Now, we don't need to worry about UVC because it doesn't get to us. It's filtered out by our ozone layer on the planet. So it's UVA and UVB that we need to worry about. And we do know that these are potentially harmful rays. So if we're exposed for prolonged periods of time, we know that UVA and UVB can cause us some harm. and that includes the eye. So although we can't see it, it does penetrate the eye tissues, and it actually does that more effectively than visible light. So it's something that we do worry about. So how can we protect ourselves, and what does it do if you don't protect yourself? So if you have prolonged exposure to ultraviolet light, we know that it can cause cataract. We know that it has a disease process that causes damage to the macular region at the back of the eye, because that's the bit that all the light tends to be focused on. And some of the UV can cause damage to the outside of the eye. So there's something called pinguecula, and these are little deposits, like sort of fatty deposits that appear either side of the coloured part of the eye. Pterygium is a growth that comes from the inner corner of the eye and grows across the white part of the eye and onto the cornea, which covers the iris, the coloured part of the eye. And that although technically speaking it's a growth, it's not cancerous, but it can cause damage to the vision. So it will need to be removed if it grows into the cornea. It causes distortion of the outside of the eye. Can also cause dry eye, and it's also, ultraviolet light is the cause of snow blindness. So if you went skiing without sun protection, then it can really seriously damage the cornea, and it's extremely uncomfortable. How can you protect your eyes? So you can protect your eyes using a hat with a brim, because the sun is above us, it's not in front of us most of the time. So you do need to protect from above and from the sides. So a hat with a brim is really good, and a wraparound sunglass will go all the way around the sides, so it will protect from light coming from the sides. If you're particularly light sensitive, then you go darker on the tint, and the wraparound becomes more important. Now, the sunglasses have to protect from ultraviolet light, and just having a dark lens doesn't mean it protects from ultraviolet light. So on my next slide, I'm just going to talk a little bit about how you choose a sunglass, because I think as an optometrist, that's the most important piece of information I can give you. So there are quality standards that have to be on a sunglass for you to know, to be reassured that it is protecting you from all ultraviolet light. So it's called a British standard, BSEN, 1836, and it's from the year 2005, and it's a CE mark as well. So that should be on the side of the frame, and sometimes you'll find a little sticker on the front that says UV 400. So if you pick up sunglasses that don't have either of those on there, then put them back down again. The good news is, in the UK, you're not allowed to sell sunglasses, even, on a market stall, for instance, if it doesn't have UV protection in it. So hopefully you won't ever pick up a pair of sunglasses in the UK that isn't of a suitable level of protection. And the other thing I want to say, and it's really important, is that a dark lens does not equal more protection. So you are not more protected from ultraviolet light because you've chosen a dark sunglass. So you can actually have a completely clear or a sort of slightly straw-coloured lens which will protect you from ultraviolet light. So it's not the tint that's protecting you, it's a substance within the lens which filters out the ultraviolet light. You may choose, like I said to you earlier, you may choose to go really dark because you're very light sensitive, but that in itself is not protecting you. It's just making you feel more comfortable. If you have cataract, lenses called blue blockers are often really, really helpful. So these are the yellows, oranges and brown tints. And blue blockers will cut out the ultraviolet light, but also the blue wavelengths that are in the visible light spectrum, because those wavelengths can cause haze in your vision and scatter the light. They're not harmful, but they can cause you to have more symptoms from your cataracts. Same, I should really put on there if you've got corneal problems, and if you've got uveitis, blue blockers are often the a better choice than a grey or a black coloured lens. Some people prefer grey lenses because they don't alter your perception of colour. So the colours seem the same, they are just duller. So it just takes the light level down. And you might have heard of something called a photochromatic lens. So photochromatic lenses change with the amount of UV that's hitting the lens. And so they'll go dark when you're in bright sunshine, for instance, and they'll go light if you're in an overcast environment. They sometimes don't work if you're traveling in a car, for instance, because some windshields now filter out ultraviolet light, so they don't go dark, and people will say, well, they don't work terribly well as a sunglass. And they don't change very quickly, so you can go from dark to light, and then and vice versa, and the lens won't have changed quickly enough. And then the other thing to say is that there are some really, really dark category 4 sunglasses, which are really good if you are struggling a lot with photophobia. If you talk to your optician, they will be able to advise you on category 4 sunglasses. If your vision is still of a level that you are able to drive a car, then you wouldn't be allowed to wear category 4 sunglasses driving a car, so they're that dark. The best way to get a good pair of sunglasses is to talk to your optician, and they will advise you what sunglasses might work best for you. And even better, if you're under the care of a low vision practitioner, they often will be able to give these free of charge as part of your low vision aids. So next we're going to move on to smoking. I think we all know smoking is bad, don't we? Everywhere you go nowadays, there's a warning about smoking, quite rightly, and we know that smoking is associated with sight loss. So this is something that everyone can do to protect themselves from unnecessary sight loss. There are some eye conditions you can't do anything about, and it doesn't matter what you do. You acquire these eye conditions, but we do know that smoking makes eye conditions worse. So that's the importance of it. So we know that AMD, I've put on the slide here, the initials AMD, that stands for age-related macular degeneration, AMD, and it is 4 times more likely in people who smoke. Dry eye from the toxins from the smoke is very common. Dry eye in itself isn't what damaging to the vision, but it's absolutely miserable. And you end up putting lots and lots of drops into the eyes. It leaves you slightly vulnerable to infection. And it can cause some additional blurring to the vision. So toxins in the smoke can cause dry eye. Cataract is at least 2 times more likely in people who smoke. And this is an interesting one that I've just put below it, retinopathy of prematurity. So babies that are born to mothers who smoke are more likely to be born prematurely, so they're therefore more likely to have retinopathy of prematurity, which has different levels of severity. In its worst case, the vision is very poor, and the baby would be registered as severely sight impaired from birth. And there's an increased risk of diabetic retinopathy and inflammation such as uveitis associated with smoking, but there's a lot of research that needs to go into that. So there's a little bit of a grey area where that's concerned. But I think it goes without saying really that, if you smoke, then it affects your circulation. So it's going to make diabetes worse, or the effect of diabetes on the back of the eye. So yeah, I think, getting some good advice about how to give up smoking, and there's lots of support out there, and it really does make a difference in reducing the conditions that can worsen as a result of smoking. So we're going to talk a little bit now about DIY and sports. These are 2 subjects I'm not very clear on because I don't do any DIY. I'm rubbish with the screwdriver, and if you see me running, it's because something really bad is about to happen, because I don't run either. But we do know that many eye injuries are as a result of people who are much better with a screwdriver than I am and much better at running than I am. So it's really important that if you are into DIY or any kind of sports, that you get the right advice about eye protection. During lockdown, when everyone started doing up their houses because they couldn't leave their houses, the number of DIY injuries shot up in the eye departments. That was one of the main things that they were actually seeing during lockdown. The eye protection goggles and that sort of thing, they have British and European standards EN 166. You don't need to know that. You don't need to go into an optician's and say about that, because they should know, and they should use correct providers of those devices. So my very strong advice is speak to an optician to get advice about the best option for your particular activity. So if there's a risk of chemical splashes, it might be a different type of lens to if there's a risk of iron filings or hot metals flying around, or a squash ball. So it's important to get the right advice and the right device, and then also they will ensure that it's protected, it's fitted properly, because if it's not fitted properly, then it's not going to be effective. It's not going to protect you. It could fall off. You could get dust behind the goggles. You could, it could be knocked flying. If you were hit with a squash ball or a hand. So contact sports particularly, you need to make sure you've got it fitted properly. Also, that if it's damaged, that it's not patched up. So you should never patch up a protective goggle or anything like that. It should always be replaced. So go back to your optician and say, look, side's fallen off or whatever's happened. And they will have a look. If it is safe to repair, then obviously they will do that. If it's damaged or if it's scratched, then almost certainly they will suggest that you replace it altogether. And that way you can protect yourself from injuries. I think people are a little reluctant to wear protective goggles because they're a bit cumbersome, a bit awkward. But my goodness, it's worth it. You can enjoy your sport and you can enjoy your hobbies without causing any risk to your eyesight. So makeup and eye infections is the next topic. So makeup can cause various different problems where your eyes are concerned. Fortunately, most of them are quite superficial, so they're usually inconvenient conjunctivitises and allergies. But you can get some very, very severe corneal infections, and it can cause loss of sight in the worst case scenarios. If you have a cornea, that's the front layer of the eye, the sort of clear dome that covers the iris, the coloured part of the eye. If you have a cornea that's already compromised by, for instance, previous inflammations or severe dry eye, then you're more at risk of allergies as well. So you just have to be a little bit cautious about this. So the general advice is always follow the expiry dates. So makeup products also have expiry dates. I mean, who knew? I didn't know that until I started training as an optician. You don't eat makeup, so why has it got an expiry date? It has an expiry date because it's a chemical in effect. So you do need to be careful on the expiry dates. There's a lot of debate about when you should throw away your mascaras and your, sort of brushes and that sort of thing. I would suggest 3 monthly is around about the right mark. You don't want to be using particularly mascara that's sort of, your old favourite that's 2.5 years old. That does increase your risk of infection from it, and it's almost certainly past the expiry date on the tube. Don't share makeup. That's a really, really good way of spreading infection. Corneal infections, conjunctival infections are very easily spread by touch. So if you use a mascara that your friend has used and they've got conjunctivitis, then you will absolutely certainly have conjunctivitis afterwards. If you're putting makeup on then make sure you've washed your hands before you touch your eyelids. Even if it's just to pull the eyelid slightly or lift the eyelid, anything that is in contact with your hands and then is in contact with your eyes is a risk of infection. Removing the makeup at the end of the day is important particularly for dry eye patients, because what we get is lots of build-up of particularly powdery makeups, flaky sort of mascaras that you can actually see it embedded in the conjunctiva, which is the sort of mucus layer that lines the inside of the lids and the white part of the eye. So people who wear lots of black eyeliner, for instance, you can actually see that there's a residue that kind of almost tattoos on the inside of the lid. So make sure that you remove it at the end of each day, as tempting as it is to leave it. It's really important. Lots of people have allergies, particularly nickel is a very common allergy, and it's found in quite a few eye makeup products. If your eye is itchy or sore or runny or puffy after you've used a product, then don't use it again. As simple as that, really. It's impossible to know what you're going to be allergic to and what you're not going to be allergic to, but allergies are usually puffy, itchy, and watery, mucousy eye, so sort of bits of kind of clear gel that comes out at the corner of the eyes. That's usually a sign that you've got some kind of sensitivity to that product. And I put on the bottom here, if you've got dry eye, avoid the powders. So powdery makeup will clog up the oil ducts that line the root of the eyelashes. So at the root of every eyelash, you've got a little gland called a meibomian gland, and that's what produces the oil that keeps the tear film intact. And if you clog that up, then your tear film breaks up and you get very uncomfortable dry eye. So yeah, it's a tricky one. I wish I could give you an exact time scale on when you should throw away your mascaras and your brushes and that sort of thing. But I would just suggest use sort of, your intuition on it. But beyond 6 months, pretty certainly there's going to be, a risk of infection from those products. If you have an eye infection, then throw everything away. And that's heartbreaking when you spend a fortune on your makeup. But even if you've had a low-grade infection, it can flare up again once you reuse the makeup. I've chosen today not to talk about contact lenses just simply because we didn't have enough time. That's a whole topic in itself. But the same is true of contact lens cases and the pair of contact lenses that you've been wearing. Just throw them away if you've had any kind of eye infection. And if you do have any symptoms of eye infection, then you should get it checked as quickly as you can. Usually they're self-limiting, you'll fight them off yourself, but sometimes you do need a little bit of assistance with antibiotics or antivirals. So I've just moved on to the next page, and I'd forgotten that I had actually put that on the next slide. If you have a red eye, remove all your makeup, throw away all your products, and don't rub your eyes. That is so tempting, particularly if you've got allergy. You tend to want to rub your eyes, they're itchy. What I would suggest is, if your eyes are itchy, obviously once you've removed all your makeup, what I would suggest is that you get some artificial tears over the counter from the chemist, keep them in the fridge, pop a few drops in, and that will stop you wanting to rub the eyes because it's really soothing and it's nice and hygienic. But if any symptoms that persist more than a few hours, you should just get it checked, even if it's just phoning your optometrist and saying, what should I do? Is this okay? If you do have an eye infection, don't share towels. So, in the bathroom, just make sure that you have a towel to yourself and you replace that towel regularly, because obviously you're going to keep reinfecting the eyes and potentially other people in the house. When to seek urgent help. If you have pain in your eyes, discharge, like sticky yellow or profusely watery discharge, or if you have light sensitivity that you don't normally have. So if suddenly you can't bear the room lights, everything's too bright, that always needs to be checked. That those symptoms can potentially be a problem with the cornea. Corneal infections need treatment urgently. So if in doubt, phone an optometrist, phone 111 and just check with them what you should do next. So keeping fit is our next topic. I think this is a logical one. I think most people would have worked this out for themselves without me explaining it, but a healthy lifestyle, healthy diet will help you look after your eyes. So controlling your weight, sort of controlling your diet, that all really helps if you have a really good green leafy vegetable diet, what they call rainbow vegetables, so making sure good range of different colourful vegetables. That's all very good for the eyes. And the oily fish. I know everyone loves oily fish, but it is very good for your eyes. A good amount of exercise, so anything that's going to improve your circulation, your heart health, your brain health, that's all going to be good for your eyes. The back of the eye is full of lots of little blood vessels, so if your fitness level drops, then those blood vessels are affected just like anywhere else in your body. So looking after yourself is well worth doing. I've put on the bottom here, managing blood pressure and diabetes. Again, sometimes this is very difficult. This is not a straightforward thing to do for many people. But having a good conversation with your GP, with your diabetes nurse, and sensibly managing both your diabetes and your blood pressure, if you have problems with those, will help to maintain your eye health, will help to reduce any progression of eye conditions that might be caused by blood pressure or diabetes. It's really important that you don't suddenly change your diabetic control, because that can cause more harm than good. We still need more research around that, but it's pretty certain that if you suddenly stamp down on your diabetes and your blood pressure, that you may actually have a worsening of your eye condition. So have a sensible conversation with your diabetic nurse and your GP, and gradually get things under control in a much more controlled manner than just going, right, okay, today I'm going to sort it all out. It's important you do that, but it's important you do it with a medic and with the correct advice. So keep it very important. I just wanted to talk a little bit about avoidable sight loss generally. So there's lots of things so we think that around 50% of sight loss is avoidable. But that includes a whole range of different things. Even things like wearing the correct spectacles. So there are some people who don't know how to access high street optometry, for instance, or find high street optometry difficult to access for whatever reason, maybe to do with their language, maybe there's language barriers, maybe there's sort of worries about money, lots of different reasons why people might not go to have their eyes tested, or they might be registered as sight impaired and then feel, well, the high street, the consultants told me that there's nothing more that can be done, so I don't need to go back to the optician. But wearing the correct pair of spectacles or contact lenses will optimize the vision that you have, and that's really important. So even if you feel that the optician can't help you, I think it's important to have that discussion with your optician or your consultant and see if perhaps getting the correct pair of spectacles will help you. The majority of people in the category that are visually impaired because they haven't got the correct spectacles, however, are people that have learning disabilities and find it very difficult to access high street care. So I think it's less and less people who are cognitively able, and more people that aren't taken to the opticians, put it that way. Cataract treatment again. So quite a lot of people will be diagnosed with an eye condition, and then as they get older they develop cataract as well, and because they're not going to the opticians, the cataract is sort of a little bit overlooked. And even if you've got a visual impairment already, sometimes having the cataract treated will improve the vision. And there are some people that, as they get older, just accept that their vision's going to get worse and that that's part of getting older, when often it's just because they've got cataract. So having a discussion with the consultant about, you know, have you got cataract? Is it worth treating that cataract? Will it improve any of your symptoms? That's always a sensible thing to discuss. Cataract treatment for most people is very straightforward. If you have some complexities about your eyes, so for instance uveitis or other forms of inflammation or bleeding inside the eye, then you need an expert cataract surgeon to discuss with you the pros and cons, the risks versus the benefits. So I'm not suggesting that for everyone treating cataract is a way of preventing sight loss. It may be a way of improving vision, and it certainly may be a way of reducing the risk of falling and the glare that some people have. And in the sort of general population that don't have any other underlying eye condition, then it's definitely something that should be considered, and for the vast majority of people, very straightforward. Early detection of glaucoma. So again, you can have eye conditions that are not to do with glaucoma, but you may develop glaucoma anyway, because anyone can develop glaucoma. Now, there are certain groups of people that are more at risk. So if you are very long-sighted, if you're very short-sighted, if you have a family member with glaucoma, people from African, Caribbean ethnicities are more at risk of glaucoma. South Asian ethnicities are more at risk of glaucoma too. So having a regular eye examination will mean that if you do develop glaucoma as well as another eye condition, or if you don't have any other eye conditions, if you were to develop glaucoma, it can be picked up at the very earliest signs and treated. You can't cure glaucoma, but you can prevent damage to the vision if you have treatment at an early stage for most people. There are always exceptions to the rule, and I've seen patients that have had all gone through the whole range of treatment, and unfortunately glaucoma still has progressed. But for most people, if it's picked up at an early stage, it can, at least the progression of the condition can be slowed down. And then we've got our diabetic retinopathy screening. So if you have diabetes, it's really important to go for those annual screening checks, and more frequently if you're recommended to come more frequently. So the first signs of diabetic retinopathy are usually a point at which you would start to look at the diabetes control and other aspects that might be causing the diabetic retinopathy to appear. People often get very worried when they get a letter from the diabetic retinopathy screening scheme that says, oh, there's background changes. Background changes in themselves are fairly harmless, but what we do is we monitor to see if that increases on the next visit. So don't worry if that happens. It's something that happens to lots of people, but it's just the point at which we start to look a little bit more closely. So I think probably the take-home message here on avoidable sight losses, there are eye conditions that can be treated to a certain extent, and to go regularly for a routine eye examination at least every 2 years, and more frequently if your optician thinks you're more at risk of a particular eye condition, or they've spotted an early sign of an eye condition, then you can sort of tap into the treatment as and when it's appropriate to do that. If your optician says that because you're registered as sight impaired, you're not eligible to come and have an eye test, or they won't test your eyes, then find another optician is my advice. because it's perfectly reasonable to go regularly to have an eye examination, and it could just protect your vision.
Come here.
The other thing that you should do is seek help if you notice a change. So if your vision does not seem like it normally does, in whatever way it doesn't seem like it normally does, phone your optician, phone your consultant, maybe phone the ECLO at the hospital if you can't get hold of anyone else, and get it checked out. So, often we'll get changes in our vision that's harmless, but it's important to take notice of change because you know your vision better than anyone else does. So if it doesn't seem quite right, then get it checked. If you suddenly lose vision, then go to A&E. That's sudden pain, sudden loss of vision, sudden onset double vision. These are all things that we want to see in eye casualty. We don't want to see them, but that's where we need to see you if that happens. Follow all the recommendations of your eye care professionals, and if you don't know what they're asking you to do, or if you don't know what you should do next, then make sure that you ask all of those questions. I think a lot of the eye departments and the opticians are very busy, and I think a lot of people feel they can't ask questions, but you can prevent avoidable sight loss by asking questions. And I think every eye care professional wants you to do that. If you don't understand what you're being asked to do or what you should be doing. ECLOs, eye care liaison officers are really, really good if you find it difficult to pin your eye care professional down to answering questions. So maybe contacting your local ECLO if you have one, if you're struggling. But it's really important that you do ask and that you do know what you're supposed to be doing with your drops or whatever, or if you're having difficulty putting drops in, like those sorts of things. All of these things will help to protect your vision. Find out about your eye condition so you can find out what's normal, what isn't normal, what you should be doing, what's the research out there. There's lots of fabulous eye condition specific charities out there like Glaucoma UK, Macular Society, Retina UK. There's a lovely website called Gene Vision, which is really good for people who have inherited eye conditions, to tell you all the latest, what the research is, explain what your eye condition is, so that you don't miss signs of a change that could mean that something's happening that needs treatment. Protecting your eyes from hazards. So we've covered quite a lot of this under the UV and the smoking and the DIY sports. But things like, spending hours looking at devices and iPads, the blue light that comes from those devices is not harmful, but it does make your eyes very, very tired. So that's really important too. So if you can sort of follow the 20-20-20 rule, so taking a break from your devices every 20 minutes for at least 20 seconds, looking away around about 20 meters. Just a look up and a down and a relax of the eyes, and then you can look back at the screen. And again, just popping in the end here, looking after your contact lenses. But I'm sorry, I had to cut something out. So contact lenses were the things that went from the talk. But it's really important that you follow all the advice and you have your contact lenses checked properly, and you don't buy contact lenses from the internet that you haven't had fitted by an optometrist first, or an optician. And I've put a couple of useful websites on these slides, and as I say, you'll get a copy of these in a Word version. Vision Matters is an organisation that goes through all sorts of different useful tips about looking after your eyes. And obviously had to give you an advert for our eye conditions pages at RNIB. We've got a range of looking after your eyes and also the eye conditions, so booklets about your eye condition. And that is the end of my slides. I've successfully avoided rabbit holes, I think. So now it's over to you to ask me anything that you want to ask.
Thank you, Louise. That was really useful and informative.